So even before the pandemic, our country was already dealing with the mental health crisis. Data shows suicides have ticked up over the past 20 years or so by more than 30%. Fast forward to today, enforced isolation along with a halt to simple everyday pleasures like going to dinner with friends, they're the perfect storm for negative emotions to take over. Depression, anxiety, even thoughts of suicide are increasingly becoming part of this conversation, but more important are ways to combat the internal struggle that isn't always easy to talk about, and for some, it goes unnoticed until it's too much to handle. Joining me now from Toronto, Canada, Professor of Psychiatry and Pharmacology at the University of Toronto, as well as CEO of AltMed, Dr. Roger McIntyre, MD. Hi, doctor. So let's use Florida as an example. It's gotten a lot of attention recently because of a surge in cases. The governor there, Ron DeSantis, specifically setting time aside to discuss the virus's impact on the mental health people in the state. He, along with his wife, they held a roundtable discussion Thursday. How important do you think it is for state and local leaders to make this more of a routine and not just happen every once in a while?
It has to be a routine every single time. This COVID-19 situation is not simply a physical health threat. This is an economic threat, as you alluded to. It's also a mental health threat. So for every press conference held by every responsible political leader, let's deal with the viral issues, the economic issues, and the mental health issues. All three are relevant to the well-being of our population. I was glad to hear that the governor in Florida was speaking to mental health. We need more people speaking directly to it.
And there's some numbers, some hard data to back this up. Also, there's been some early polling by the American Psychiatric Association. It's shown that a third of Americans have COVID. They've been dealing with some sort of a serious mental health issue. In the crisis hotlines, they've reported a dramatic uptick in phone calls. But Congress, or the administration for that matter, they have yet to detail any sort of plan to address that specific issue. Do you think that that's something that requires attention from the federal level?
We need attention at all levels, the federal, the state, the local level. You articulated it again very well. Not only are we seeing an increase in depression and anxiety, Express Scripts, one of the well-known pharmacy benefits manager in the United States, is reporting a 35% increase in prescription for anxiety, a 20% increase in prescription of drugs for depression. We're seeing the early storm starting to happen. We conducted a projection analysis, and we also have to be very cautious with projections, but we can learn from history. And what we learn from history is what I call the 1% rule. For every 1% increase in unemployment, we see a commensurate 1% increase in suicide. And that's been replicated in Europe, it's been replicated in Asia, and in North America, Canada, the United States. We all hear unemployment statistics that are difficult to comprehend. We have a serious problem. So all levels of government have got to prioritize this now. That is why the approach to this is not coming from a public health official. It has to come from a public health official, economic officials, employer officials, and the politicians. This is a multi-pronged approach, and that's why just dealing with the virus alone, neglecting social health and mental health makes no sense.
There needs to be a all hands on deck approach as opposed to pointing the finger at somebody and being, you're responsible for this. It needs to be everybody, is what you're saying.
Right.
So there's also some experts that they're saying cases of anxiety and depression, they're rising among young teens specifically because of all the stresses and uncertainty of the pandemic. What steps can our leaders take to address that specifically, especially when some are calling for schools to resume, others are opposing that idea and they want schools to stay shut this fall?
We have to have a guiding principle. The guiding principle is the evidence. What does the evidence tell us? The evidence unequivocally tells us the kids should be back to school. Why do we know that? Well, because 22 countries in Europe have done this successfully. We also know that children are reporting an increase in depression and loneliness, which is linked to suicide. We also know that we depend on our school teachers to identify children who are victims of physical and sexual abuse. We also know that staying at home disadvantages young Black children and poor children more than white children and middle-class children. Here's the final part. Women end up paying more of the price when children are at home. Now, going to school should happen immediately. I agree with the Journal of Pediatrics. Kids should go back to school. But we have to obviously recognize public health common sense. It's the 3 C's. Please wear a mask in a closed space, in a crowded space, or in a close contact space. And use a heavy dose of common sense. If you don't have the 3 C's and the kids are back to school, we got a bit of a problem. But the economy will not fully open until the kids are back to school. And the Europeans, I'm increasingly thinking the Europeans are smarter than us in so many ways, but they're doing this so successfully, no problem,
Right.
advanced, intelligent people.
Would you say that the act as a model then, in the last couple of seconds we have, should we be modeling our response, especially when it comes to opening schools, should we model them to some countries that we've seen have success in Europe?
Absolutely. Denmark, Germany, many countries, OECD, wealthy, intelligent nations. These people are doing it right. They're doing it right because they recognize the evidence. They are, in fact, having a coherent approach, which is social, economic, political, and medical, and they're letting the evidence guide it. Unfortunately, the melody in North America, the political ideology is winning out rather than the health of our young children. It's a disaster.
Interesting. Interesting insight. Thank you so much for speaking with us, Dr. McIntyre. Thank you so much for your time.